In this video, we're going to show how to treat the concave side of the thoracic part and the convex side of the lumbar part, and how to position your patient in the right side. Okay, so normally here we have convexity in the lower part. So if I'm going just to leave the person like that, I'm not stimulating the elongation of the spine. So you have to bring maybe a towel or a small ball like mine, and then you are going to bring your ball at the thoracic part, just come a little bit up please, of the, where is the convexity, okay? And the patient is going to lay down in this position, and she is going to bring her hand up in 180 degrees of abduction, okay? So here we would have the convexity would come up, and here the concavity will open, which is, this is the regulation or the correction of the thoracic spine in the frontal plane, okay? We are pushing the convexity and we are opening the concavity in the left side, okay? Now we are going to correct the lumbar spine. Now in the other side we have an S form, so the right side, which is concave side, we want to open it. And how we are going to open it? We have to elongate and bring the right leg in extension, okay? If we bring the right leg in extension and the left leg in flexion with a ball in front or something else that the patient can bring in flexion in front of her side, then we are correcting the lumbar region in the frontal plane. We are opening the concavity, which is in the right side, and we are closing the convexity in the left side, okay? So this is the correction of the frontal plane. Of course, we have corrected our patient in the sagittal plane, because when we are doing an elevation of the shoulder, and then we are of course extending the thoracic region, and when we are doing an extension and flexion here of the hips, we are also stabilizing the lumbar part. But of course, if you have a patient with an hyperlordosis, you can keep both of the legs flexed, but I will explain this again. Now, the idea is to correct and to activate the rotation of the thoracic part and of the lumbar part. We know that the thoracic part in the concave side, what normally, if we have concavity in the left side, normally without correction, the ribs are anteriorly rotated. Here they are closed and they are open in the anterior part. So what I want to do with my exercise is activate and open the ribs in the posterior part. So I'm going, how I can open the ribs in the posterior part? I can open the ribs in the posterior part if I'm going to ask the patient to rotate her ribs backwards. When you are going to rotate the ribs backwards, automatically you are going to open the ribs in the back side, because when you are rotating, we have to be very careful also not to rotate and extend, but we have to rotate and elongate. When we rotate and elongate, we open the ribs in the lower part, we close the ribs in the anterior part, and we open the ribs in the posterior part, okay? So, I'm just going to work here a little bit, so I will explain to you. The patient is in a normal position, and now I'm just going to, I will bring my hand in the back part of her thoracic, of her ribs, and I'm going to ask my patient to slowly rotate her ribs against my hand, okay? So I'm just putting some resistance against her. What most of the patient will do, rotate, 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 great, great, great. You see, she's rotating and also elongating. So she's rotating and elongating her hand. But what most of the people do, when you say push against me, they will just do extension, which is nothing, which it's not a correction. So you are going to ask the patient, bring the shoulder a little bit more up, okay? So you see, we are opening more the ribs. Put your hand against her and then come against me. Okay. If she's extending more or rotating more with the upper side, you are going to bring your hand a little bit more down and you are going to ask to push the lower ribs against your hand. Great. Push, push, rotate. Great. Stay here. She's rotating and then just stay against my hand, so she's doing a resistance. Just breathe in. Breathe, breathe, breathe. With respiration, you are opening more the ribs and breathe out. Breathe in and breathe out. Great. Okay, so she can breathe 3 times. And breathe out and relax. And now again, rotate against me, down, down, here, down. Perfect, perfect. And all the time, I'm just doing some resistance against her movement. Breathe in, breathe out. Breathe in, perfect, and breathe out. Perfect. Or you can put the whole hand here and again come against me. Perfect, perfect, perfect. Okay, and now breathe in and breathe out. And she's breathing, you see that her ribs are opening. Okay, perfect. Now you can work with the thoracic spine like 10 times with 2 to 3 inspirations. And now you are going to work with the pelvis to show her what to do while you are doing the thoracic spine. Now, normally the pelvis, as we said, when we have a convex side, normally the convex side is depressed and rotated posteriorly. What we are going to do with this correction is we are elevating the pelvis, so we are closing the concavity in the frontal side. And now we want to rotate the pelvis anteriorly. And how you're going to do this is by asking the patient to push their knee forward. When somebody pushes the knee forward, then you're rotating the pelvis forward. So this is the correction in the transversal plane. Okay, relax. So I'm just going to ask my patient I'm going to put resistance on her knee, and I'm going to ask her, push your hand against me. Great. So you see she's elevating the pelvis and she's pushing against me. So she's correcting her scoliosis. Relax. Perfect. So now this is something she will do while we are rotating the thoracic spine. So we will begin from the beginning. We will ask our patient to rotate. Now here she's doing nothing, okay? She's going to rotate her thoracic, her ribs backwards. Great, stay here, against me the whole time. And now push your knee forward. So what she's doing, stay in this position, perfect. So what she's doing is she's rotating her ribs backwards and she's rotating her pelvis forward, okay? Relax. We're going to show it again. Again, go backwards, backwards, backwards. Here, stay here, please, okay? Relax your pelvis now, and now come forward, okay? And now she's keeping resistance on my hand and here on my hand, okay? And now, while keeping her resistance, she's going to breathe in and breathe out. And while they're doing this, the patients are going to feel stretching and activation of the abdominal wall, of the core, okay? Which is great. So she's going to breathe in and breathe out. Perfect. 3. Inspiration, expirations, and relax. And now we can do it again. Rotate, come forward, forward, breathe in, and breathe out. Okay, perfect. Relax. In a case that you have a patient with a big hyperlordosis, then you will have both of the legs in flexion. Okay. So, of course, here we don't have a lot of correction of the lumbar spine, the frontal plane, but again, you are not activating the lordosis a lot. And you will do the same thing. You are going to ask the patient to rotate backwards, perfect. And now she's going to push only her left leg in front. Perfect. Okay, perfect. Stay here and breathe in, breathe out. This is only in cases you have a big hyperlordosis and you want to correct the hyperlordosis in the sagittal plane, okay? And you can do this in the first sessions. You have to do this a lot of times so the patient will understand what to do. But in the other session, of course, just 10 repetitions with 2 to 3 respirations. Each repetition is completely enough. And after this, we are going to try and work with the right side of our patient.